figured out what we're going to adjust in Christian, right? We found three majors on Christian. We found a fourth cervical, seventh thoracic, and down in S3. Yeah? And do you mind sharing what's the number one reason you came?
I had a spine injury, and after that spine injury, I just started having trouble breathing. And I went to my doctor, and I went to go see specialists, and they couldn't tell me what was going on.
So the good news that he went to every specialist. He had everything ruled out, nothing serious, right? They couldn't find anything.
Yeah.
And this breathing issue started after a trauma, correct?
Yeah.
Okay. And without getting into all that history or whatever, the point is that, so the breathing, now let's describe that breathing. Is it a shallow breath, like if you're having trouble taking it in, or blowing it out?
Like the best way I can describe it is when you get hit in the stomach really hard and you kind of lose like your breath.
Okay.
So you try to like breathe, but you can't.
So you can't get it in.
Yeah. I just feel like it's restricted, like
to bring it in.
Yeah.
Okay. So let's talk about the difference between inhalation and exhalation.
Okay.
Breathing in is mainly through what? The diaphragm. That control of the diaphragm is 3, 4, 5.
Okay.
It's part of the phrenic nerve.
Yeah.
And you actually told me that, so that's good.
Yeah.
3, 4, 5 we learned in school keeps the diaphragm alive. It's the major area that controls the diaphragm, bringing it down.
And that helps your ribs expand, right?
Correct. So how does breathing happen? The diaphragm goes down, it opens up the space, opens the ribs, so it allows more oxygen in.
Yeah.
When you push it out, exhale, everything goes back, right?
Yeah.
But the pushing out there's not a lot of activity going on with that. It's more like a negative pressure.
Yeah.
It takes more energy to get that diaphragm down.
Yeah.
Make sense?
Yeah.
Okay. So, without getting into the rest of it, we do know we have pressure at 4. We do know we have pressure at 7, and we do know we have pressure at S3. So let's get started. And before I do this, can you take in a nice deep breath? Take in 3 nice deep breaths. I'm just checking your pulses. Deep breath. Take it in deep. One more time. So he's having to breathe in 3 times for 1 breath.
Yeah.
Is that normal for you the past few months?
Yeah.
Okay. Do it one last time, please. Okay. Let's start on C4. Over here. Sit all the way back for me, sir.
Okay.
Center on the chair. Scoot to the left a little bit more. Thank you. Left hand up. You were a baseball pitcher, you said.
Yeah.
Cool. I'm using this to stabilize the upper body, okay? There you go. Now, palms up, resting on your thighs, feet out, resting on your heels, and go from there. 2. And lighten it up. There we go. Good. I need you to just let that drop. That's a piece. That's not all of it. Sit up a little straighter. Let's try a different angle. Scoot, you okay?
Yeah.
Scoot back for me, please. And slightly to the right. Scoot your butt slightly to the right. That's it. Good. And C4. There it is. Good. Gotcha. Look up.
Oh.
Gotcha. Home run. Give it a second. Come over here, please. Stand on the black platform, sir. And before we continue, take in a nice deep breath. Face down, please. We're going to do T7 and S3. Now I'm gonna do S3 slightly on the left side because he's got the rotation of the sacrum as well. Hands forward, sir. You doing okay there?
Yeah.
Cool. I'm down low, S3. There it is, good. A little more. Gotcha. You're okay. Gotcha, brother. All right, so what we're gonna do, once you come off your table, I'll have you walk it off. We got you. And taking a couple of nice deep breaths. And just follow his walk. Keep going. It's a little different.
Yeah.
Can I go deeper on your sacrum?
Yeah.
Let's go on the knee chest too. So I got the new one here. Let's bring your knees over here, sir. Face down. Face there. Bring that back. There you go. Awesome. Perfect. So we're gonna bring the knees back a little more. There we go. I want to get a little more through that joint for you. Good. Tummy down. Up and down. And that's the home run, my brother. Come on up. A little deeper on that one, yeah?
Yeah.
As you're walking, tell me what's different.
I just feel like more loose. Like
What's loose?
my hips.
Keep walking, Grace. You're walking a little smoother, my friend. Cool. Come back over here, have a seat. Let's run the meter on your back. Let's see what's going on. And the first thing is this puffiness is already coming down. Do you remember how much I was pinching?
Yeah.
Look, it's pretty tight. So the big thing is, let's see what happened at C3, 4. Now we just got heat, clear. Mid back is clear. Sacrum is clear. Scoot forward, please. Check this out. Come back slowly towards me. That's L5. S1. S2. Do you remember S3?
Yeah.
What's different?
It doesn't hurt.
Now. 7. Sit back, center up on the chair so I can feel your neck. Awesome. Head down, please. 2, 3. A little tender, but it's moving now. Yes?
Yeah.
Now, taking a couple of nice deep breaths. You don't want to get too excited.
Yeah.
I know, I get it. We had to wait for the second visit, make sure it's not a
Yeah.
fluke, right?
Yeah.
Party tricks on YouTube. I'm joking.
No, I feel like a big difference.
Tell me, what's up?
I mean, I just feel
Tell me,
like-
what's up?
Just like before, like I just feel like really restricted, like, and now I just feel like everything's like trying to, or starting to like loosen up.
Okay. So you're feeling you can take in a little more air?
Yeah.
Okay. Not bad, huh?
I mean, yeah, I feel a lot better.
All right, let's continue. Sit up straight for me, please. Your lung pulse is also better. The breathing is better. The sitting is better. That pseudo, I'm making fun of you, it wasn't back fat, it was swelling.
Yeah.
Okay, it's half gone now. Pretty cool. Let's do the shoulders. Over, around, baseball style pitch. There. Over, around, down, pitch. There. Ears. Nice. Go on your back, sir. Let's work on your feet. Get some paper there for you. Good stuff. I think the real test though will be our next visit.
Yeah.
You know what I'm saying? See how it holds.
Yeah.
Where is my board? Raise your right leg, please. Ankle. Raise your left leg, please. Stand up for me. Squeeze my hand. Squeeze hard. Good. Closest thing I got to baseball, I used to be a Little League photographer. Right? Over at Blvd. Wrist. Elbow. Thumb. Elbow. Right? Trapezium. Thumb. Go like that 5 times fast. Squeeze hard. Squeeze. Do a couple of push-ups. Do 5, quick. Good. Stand up. Do 5 jumping jacks. No joke. 5 jumping jacks. Quick. Turn around, face me. 5 jumping jacks. Just quick. Don't think about it. Walk it off one last time and let me scope, make sure everything held, and then I know you're good to go, okay?
Yeah.
His walk is completely different. He's got movement in his SI joints now. Pretty freaking awesome. Good stuff. Have a seat, please, here. Now, your homework, water, walking, and ice, okay? You're drinking 1 gallon a day. You're icing the areas I adjusted 2 to 3 times a day.
Okay.
And you're walking 1 hour a day. You want to do elliptical with handles is fine. You want to swim, bike ride, no issue. You don't need to be doing any weights right now.
Okay.
Which I don't think you want to do anyway right now.
No.
So the biggest thing is I found 3 major areas of pressure in your spine. I fixed it. From a symptomatology, you came in for to check your spine to see if that could have been the reason your breathing was off.
Yeah.
But I'm not fixing your breathing.
Yeah.
But what happened?
I mean, yeah.
Stand up for me, please. Squeeze my hand. Squeeze hard. Good. That's where we're going to start.
All right.
Welcome to the office.
Thank you. Appreciate it.
You got any questions?
I mean, I'm just thankful, finally, found some type of relief.
I'm going to see you in a couple of days.
Okay.
And we're going to follow up, see how you did.
Okay.
Okay? And then we'll make some decisions. I'll tell you what we need to do. You tell me what you want from there.
Okay.
Cool?
Yeah. Thank you.
You got it.